All right, you've heard of this stuff called Kinesio Tape. It's been around for years. It is the bright tape that a lot of athletes use. You see it a lot in the Olympics. And now to find out more about it is chiropractor Dr. George Stribling. Dr. Stribling, thanks so much for coming in. Appreciate it.
Thank you very much for having me.
You're one of the first doctors to use the Kinesio Tape, correct, on patients?
Yes, I'm the first chiropractor to use it. There's one other physical therapist that's used it as long as I have.
And it's from New Mexico, too. This stuff was developed right here, right?
Actually, the guy that used it was a Japanese guy named Kinesio Tape.
Okay.
He practiced chiropractic in Albuquerque back in the 70s, and then he moved back to Japan, came up with the tape, and brought it back to Albuquerque in around the mid-'80s or late '80s.
Okay, so what does it actually do? How is this stuff different? We know it's brightly colored, but how is it different than just regular athletic tape that you see athletes with?
Well, this tape is made to simulate skin. It's made to be the same weight kind of a skin, the same elasticity of skin. It stretches, this tape stretches in a longitudinal pattern,
right, okay,
rather than horizontal.
Okay.
And so when you apply it, it functions like skin and muscle, and it changes the pressure of your nerve receptors under the skin.
Okay, I think you're going to try and tape up my knee today to show people. All right, let's get started.
All right.
So you buy this stuff. Where do you buy it, first of all? And then you're putting on like a sort of a...
I'm putting on a little biofreeze.
Okay.
And the reason I put biofreeze first is because it helps the tape last longer.
Okay.
If you don't put it on, it might last a couple of days. With tape this, it'll last 4 or 5 days.
Okay, because I've used it a little bit before, and I've had problems with it sometimes like coming off too quickly. And that's what this works with?
Yes, yes. You can't use it if you have you know, much oil. You got to take the oil off of your skin. You got to make sure you do that first. And then I apply this. It gives it a little bit of a tacky adherence.
Okay.
But it doesn't interfere with the tape.
All right.
And I'm taping your knee today. There's lots of other things I can tape.
Sure, yeah.
But we use your knee for make it easy today.
Okay.
I can tape your iliotibial band, your low back, neck, shoulders, you name it.
Awesome.
For you, I'm taping your knee.
Okay.
So most runners, like people that run a lot, eventually their kneecap begins to settle down, and it begins to get that grinding, and so this taping, when we do it, what I do is I bend your knee a little bit.
Okay.
And then I've already pre-cut this tape.
Gotcha.
So we're going to do this, see, and then I just bend your knee a little bit more, and what we've done, I've done this into different, we're going to do that. I'm going to bring it out over here like that. And then we got this pattern here.
Okay.
Now if you notice here, watch what happens when you straighten your knee out.
It bends right along with it.
Right.
Yeah.
So
okay.
It's helping your patella move better.
Okay. We got to do real quick on these other two. For people who are interested, they can head to our website at casa.com. There's your information there, so you can tape people up, or you teach them how to tape themselves.
I tape. They have products out there to help them tape themselves, but really the mastery of the product comes when you learn how to stretch it.
Gotcha.
You can stretch this tape 10%, or you can stretch it 100%.
Okay.
And you do that for different parts of. Depending on the condition, like if I'm taping an Achilles tendon, I'll take all the stretch out of it.
Okay.
If I'm taping your neck, I take maybe 10% of the stretch out. We work on a lot of auto accidents, people that have soft tissue injuries.
Oh, okay. So not necessarily just for athletes, for folks who have been hurt as well.
Oh, yeah, whatever, any kind of joint-related problem.
That's awesome. I can't wait to go for a run like this with it on today.
That feel a little different?
Yeah. That feels definitely much different than any other kind of tape.
Exactly.
Dr. Stribling, we're out of time. I'd love to talk with you more about it.
Thank you very much.
Appreciate you coming in.
I appreciate the opportunity.
There's more on our website. Stick around. We'll be right back.